To begin, we first verify the physician's order, checking the correct medication, dosage, route, and timing. Next, we perform proper hand hygiene to reduce the risk of infection. We gather all necessary equipment, which includes the prescribed ophthalmic medication, clean gloves, sterile cotton balls or gauze, tissue, and the medication administration record or MAR. We must also do the 3 checks of the medication label when retrieving the medication, before preparing it, and before administration. Then we confirm the 7 rights of medication administration to ensure safety. Afterward, we introduce ourselves to the patient, verify their identity using at least 2 identifiers like name and date of birth, and assess for any allergies, especially to medication. We explain the procedure, its purpose, and what the patient should expect. Lastly, we ensure privacy by closing curtains or doors as needed. For administration procedure, start by positioning the patient either sitting or lying down with the head tilted back and eyes looking upward. Don clean gloves and inspect the eye for signs of infection or discharge. If there's discharge, clean from the inner to the outer. If there's a discharge, clean from the inner to the outer canthus with sterile cotton or gauze. Remove the cap from the medication, being careful not to touch the dropper tip to any surface. Hold the dropper 1 to 2 centimeters above the conjunctival sac. Use your non-dominant hand to pull down the lower eyelid gently. Instill the prescribed number of drops into the conjunctival sac without touching the eye. Instruct the patient to close the eye gently and apply gentle pressure to the nasolacrimal duct for 30 to 60 seconds to prevent systemic absorption if appropriate. If more than 1 medication is needed, wait 5 minutes between each to ensure proper absorption. Finally, recap the medication without contaminating the tip and dispose of all used materials properly. For post-administration, after the procedure, remove gloves and perform hand hygiene again. Document all important details including the medication name and concentration, number of drops administered, which eye was treated, the time of administration, and the patient's response, including any adverse reactions. Lastly, educate the patient on any aftercare or precautions and ensure their comfort before leaving.